Hello, Dr. Fred Southwick here. I've been updating the latest data on COVID-19 vaccination, and I contacted Dr. Paul Offit, Professor of Pediatrics at Children's Hospital of Pennsylvania, CHOP, as a world-renowned expert on vaccines and a member of both the Advisory Committee on Immunization Practices to the CDC and a member of the FDA Vaccines Advisory Committee. And I found his analysis of vaccine boosters to be very clear and based on current data. He didn't have time for a one-on-one Zoom interview, but gave me permission to share excerpts of his recent interview on This Week in Virology with Dr. Vincent Rancinello and Dr. Richard Condon. You can watch this weekly internet broadcast at no cost to learn the latest about COVID-19 and other viruses. Their discussions are always lively and based on the very latest data. Here is the web address.
Our guest today from the University of Pennsylvania, Children's Hospital of Pennsylvania, Paul Offit. Welcome back.
Thank you. Thank you for having me back.
Yeah, you've been on quite a bit, and there's good reason because you have a great take on the COVID vaccine situation, and that's why we have you here today. A couple of weeks ago, or 2 weeks, you sent me an email, and the first line reads, "The bivalent booster dosing story should be a cautionary tale of how not to move forward in this pandemic." And then you set forth your reasons for saying that. And I thought this would be an important issue for people to hear as we're moving into holidays and people are wondering if they should get vaccinated or whatever. So what's the story here, Paul?
So when Omicron came into the United States, end of December 2021, beginning of January 2022, this was an immune-evasive strain. So it had had a number of changes in the receptor binding domain, at least 15, and so it escaped largely neutralizing antibodies that had been induced by the vaccine or a previous infection. And that worried people. It worried them that this could then render monoclonal antibodies ineffective. It worried them that this could render the vaccine ineffective. And so there was an interest by the companies and by the government in moving forward with a vaccine that contained that strain, the BA.1 strain. And so both Pfizer and Moderna then made a bivalent vaccine that included the original strain, the ancestral strain, and this BA.1 strain. For Moderna, it was 25 micrograms and 25 micrograms. For Pfizer, it was 15 and 15. They then did studies the right way, involving a few hundred people in each group, to answer the question, if you got a monovalent boost as compared to a bivalent boost, did you have a greater neutralizing antibody response against BA.1 with the bivalent vaccine? And those data were...
Excuse me, you said monovalent versus bivalent. Monovalent being the ancestral strain?
Yes, sorry, yeah, the ancestral strain only as compared to the ancestral strain plus BA.1. Okay. So the companies then presented their data to the Vaccine Advisory Committee, the FDA's Vaccine Advisory Committee, on June 28th of this year. And the data were underwhelming. They did the studies the right way. They looked at the same interval for getting a monovalent boost or a bivalent boost. And there was, depending on which company you were talking about, a 1.5 to 1.75 fold increase in neutralizing antibodies against BA.1, which was unlikely to be a clinically significant difference. We saw, for example, back in December 2020, when Pfizer and Moderna presented their data, Moderna had roughly a twofold increase in neutralizing antibodies against the ancestral strain as compared to Pfizer, but that didn't work out to be any difference in terms of protection against serious disease, which is the goal of this vaccine. So that nonetheless, the fear was that these viruses were continuing to evolve and that these variants would become even more resistant. And so the decision was made by the companies and the government, the FDA, to move forward then with a bivalent vaccine. But at this time, and this is already a cautionary tale, by this time in June, BA.1 was gone. So all this work that had been done on the BA.1 bivalent was to be thrown out. And so because BA.4, BA.5 now in June of this year was predominant, they moved forward with a bivalent vaccine containing BA.4, BA.5. And then what happened was the day after we met, the government issued a press release saying that they were going to buy 105 million doses of Pfizer's BA4, BA5 bivalent vaccine. A month after that, on July 29th of this year, the government stated, HHS, DOD stated that they would buy another 66 million doses of Moderna's vaccine. So therefore, the government purchased 171 million doses of these bivalent vaccines pretty much without any human data at that point. So then what happened is, again, without human data, on September 1st, the CDC, at the same time that the FDA withdrew its EUA for a monovalent vaccine, then recommended a bivalent vaccine with BA4, BA5, again without any human data, for everyone over 12 years of age. A month and a half later, on October 12th, they extended that recommendation to include everybody over 5 years of age to receive a booster dose, period. No attempt to try and just focus on the high-risk groups, which would be the elderly, people who are immune compromised, people who have high-risk medical conditions. Everybody over 5 should get this vaccine. The first human data to appear occurred out of David Ho's lab at Columbia, where he had a preprint on August 22nd that was available, which has now been accepted for publication at the New England Journal of Medicine, doing the studies the right way, where he looked at a couple dozen people who had either gotten a monovalent boost or a bivalent boost with BA4, BA5. No difference in neutralizing antibodies. It wasn't even a 1.5 to 1.75 fold difference. It was no difference in neutralizing antibodies. And then 2 days later, Dan Baruch and his laboratory at Harvard did the same study, looking at whether or not this bivalent vaccine containing BA4, BA5 increased neutralizing antibodies. Not at all. And he also looked at T cells, specifically CD8 or CD4 positive T cells, to see if that was enhanced. Not at all. And so basically you're still waiting for some human data to suggest that this is a value. What then happened was the CDC, and Dr. Griffin actually reviewed this study, had a publication in Morbidity and Mortality Weekly Report looking at what happens if you get a bivalent vaccine, and period. They didn't compare it to a monovalent vaccine because the monovalent vaccine booster dose EUA had been withdrawn. So you were just looking at people either got a bivalent vaccine with BA4, BA5 or didn't. Now, this was when BA4, BA5 was still predominant. And what they found was that—
excuse me, this is in people who have otherwise not previously been vaccinated?
No, these are people who have received 2, 3, or 4 doses of the monovalent vaccine.
Okay. So it's not what you're saying is it's not a head-to-head comparison of monovalent and bivalent in this boost, but just the bivalent. Okay, fine.
That's right. You could only compare it to historical boosts with monovalent.
Fine.
You couldn't do it at the same time. And what they found was that there was essentially a modest increase in protection against mostly mild disease within a month of having received this boost for what would likely be short-lived protection against mild disease. And that was it, which is not a reasonable public health strategy to just sort of increase protection against mild disease in the short term.
But there was no severe disease in this study, if I remember right.
Just mild disease. So that's where we are. So now you have the government, which has purchased 171 million doses of the vaccine, about a little less than 40 million, so about a little more than 10% of people in this country for whom this vaccine has been recommended have gotten it. But now where are you? I mean, now you're in December. BA4 is gone. BA5 is less than 25% of circulating strains, only to be replaced by, BQ1, BQ11, XBB, XBB1. So again, which are somewhat more resistant than to those neutralizing antibodies you would have gotten had you actually had an increased antibody response to BA4, BA5. So I'd like to think the lesson here is don't do this. Don't chase variants, especially since the current vaccines are still protective against serious disease. That's the good news about these vaccines. They still do protect against serious disease. A variant hasn't yet arisen that is resistant to protection by either immunization or natural infection to serious disease. So you're not pressed at this point.